My guest today is Dr. Krishna Mohan. He's a surgeon practicing at Prabhu Hospital, Moodabidri, which happens to be his own hospital. He is also a mountaineer, a wildlife conservationist, nature photographer, and he's the current serving secretary of CyberForum of Mangalore. Welcome to the show, Dr. Krishi.
Thank you.
Okay. So we are right now in the midst of the second wave of COVID. Have you received your COVID vaccine?
I have not received it.
You've not received.
I have not taken it.
Okay.
There's a reason behind it. Okay.
Is it intentional? Or?
Yeah, intentional in the sense I was infected with COVID.
Okay.
So, being already getting immunity from natural viruses,
Okay.
why go for the dead ones?
It's a very controversial opinion at the time
I
being.
agree.
Is it because we are conditioned to think that way, or
Scientifically, we are not really explaining why these vaccines really work or don't work, how they work. That part is been hidden from the general public, also with the medical fraternity.
Oh.
The reason is every vaccine basically goes through a lot of studies. Phase 1 study, phase 2 is basically inside the laboratory on animals, animal models. Then phase 2 is basically volunteers. Phase 3 goes into the public but volunteers. Then we find out whether it works or it doesn't work, or it has adverse effects, reactions, deaths. After that, it goes into a much larger population. There it gets tested. Now, because of the time shortage, all these vaccines are not approved as a treatment or prophylaxis to corona. They are labeled as emergency use only. But we are throwing 130 crore people into this emergency use only vaccine. Government is not explaining. All over the world, all the governments are insisting that you have to have a vaccine. I agree, vaccines are required to mitigate this pandemic, so-called pandemic.
you say so-called pandemic?
Yes.
So are you of the opinion that this is not really a pandemic?
No, it is a pandemic
Okay.
created by our own. In the sense, it's a virus. Now, flu pandemics, the Spanish flu is the
Okay.
best example of 1918 Spanish flu. That was a pandemic that killed a lot of people. Whereas after that, the same 1918 Spanish flu still exists in a different form, mutated, still exists. So that is one example of a pandemic which was managed in a state when there was no treatment available, no vaccines available, nothing was available at that time. So even now, we are taking the same strategy of 18 to 19th century prohibitions, keeping people inside, locking them out.
Do you think those kind of policies are outdated?
They are sort of outdated in the sense, remember, this disease kills only 7 in 10,000 people who are infected. That means it's very, very negligible amount of death. I mean, the reports say that, so many people died, no hospital beds, and all those things are exaggerated because the number of cases is so much. We have per day around 3 lakh people who are getting infected. But if you see the percentage of deaths, it's negligible, very negligible. We have bigger diseases which kill more. Tuberculosis, one of the best example, kills quite a lot of people. And it's also a sort of a pandemic. I won't name it as a pandemic, but it spread so much in India that a lot of people have tuberculosis. Cardiac diseases, they are the main killers. So there are a lot of other diseases which kill more people than this one. But this is a politically sensitive disease. So that's why the response from all over the world against this is over the top. And remember, they don't listen to scientists, they don't listen to the doctors, they don't listen to the medical personnel, they don't listen to epidemiologists. It's a politically managed sort of a mayhem. And now we are into midst of that, the second wave. We all said there will be a second wave. We were anticipating that in somewhere in November to come, when the Europe almost had it. But luckily, because the flights were stopped, international flights were stopped, we didn't get that wave. What we got was a wave as soon as our flights opened. So the first variant which came into India, which a lot of people talk about, that B167 variant, that's a British variant. Then there are so many other variants. I mean, the virus always mutates. It mutates daily. So none of these mutations are really drastic mutations. They are small mutations. So making a big hype out of it is really more of a media hype. So that's what is happening now.
There's a lot of exaggeration and hype, and as a result of this exaggeration, there are lockdowns. We're seeing that there might be another lockdown from tomorrow. Do you think lockdowns and night curfews are an effective way of fighting this disease?
No. In fact, it is the other way around. Let's take the first lockdown in India. When the first lockdown was announced with just 4 hours of time given to people to move around and go back to their places, at that time, let's take Karnataka for example. We had only 11 cases, and all the 11 cases were in the hospital. There were few who came down internationally. There were 2 deaths, 1 death in Mangalore itself. So all of them were inside the hospital. There was nobody who is roaming around in the cinema theaters or malls with COVID. Now the situation is totally different. Now there are a lot of people who are infected, who are spreading infection. And you are again cooping them up inside a small places, houses. Okay, now you give 2 hours for essential goods. Now, for example, today 9 p.m. onwards to tomorrow, Monday 6 a.m., there is a curfew. So let's talk about early morning of Monday. What will happen? People need essentials. So they all rush.
There will be a panic buying.
There will be panic buying. Okay. Now in that rush, even if there is one person who is infected, you can't maintain a social distance. So this is a infection which basically spreads by talking to each other. So if you talk to somebody very close, that guy will get it.
Yeah, a lot of this information comes out of WhatsApp, unfortunately.
Yes. Social media is another killer as far as this particular disease is concerned. So the misinformation there, irrational treatments, all those immunoboosters and hot water and ginger, turmeric and all sort of
Coronil.
things. Coronil, yes. And the person who made Coronil itself has, so many corona patients in his factory.
So, you had been infected with COVID-19. How was your experience?
No, I didn't have any symptoms.
Okay.
Only a little bit of loss of smell to my wife. She also practices with me. So that made me suspect that I also had it. And then we got an antibody tested, and antibody was, both of ours was positive. That way I knew that, I was infected.
Okay.
Remember, nearly 80 to 90% of people who got corona will not experience anything. They might have a mild fever, cough, headache, sneeze. You feel like, you had a cold one day. So next day, some body pain. Some people, about 20% will have diarrhea. One of the major things which really stands out is the loss of smell. That is also not universal. It's about 40%. Now again, the loss of smell is not just specific to corona. So many other things. Even a common cold will give you a loss of smell. So not to say that, somebody who has a loss of smell will have to be looked as a corona.
It could even be allergies, anything.
Yes, it could be anything.
So how effective do you think the vaccine is against COVID?
As of now, I don't have a trust in both Covaxin as Covishield.
Okay.
One more thing is, we don't know how long, even if it works, let's say if it works, okay? We don't know how long the effect will last, because we don't have a long-term study. So the vaccine just came up. It brought out immunity. We'll take these 2 vaccines. For example, Covaxin. Covaxin is basically an adenovirus, the cold virus of a chimpanzee. That is a Covishield. Covishield is a adenovirus from the chimpanzee. It brings a common cold in chimpanzee. So the same virus is been killed and then modified to have a features similar to the spike protein of our coronavirus. So there are two things. People who already have antibodies will overreact. And that may be the reason why those people ended up in thrombosis. One of the biggest reason why Denmark banned it and few of the European countries banned Covishield.
What is thrombosis?
Thrombosis is a blood clot. Blood clot formation and may be fatal. So it's a reaction to the vaccine by the body. So it's not rampant. There are very few cases, but still that risk is there. I'll give you another example of a similar vaccine effort for our bird flu, swine flu, H1N1, swine flu. That they created a vaccine, but that vaccine had so much of side effect, they had to withdraw the vaccine. So these vaccines are a sort of, lot of try and miss, and then one of the vaccines really work. But this time, almost every company who has manufactured a vaccine brings it out as the vaccine which is working. So as a scientist, I feel that there is something really missing there. Everybody wants to make money, but not life of the humans.
Do you think they're not being transparent enough with the medical community, the companies?
Definitely, that the records are not there. Usually what happens is every drug which is proved will have to go through a peer-reviewed journal and get published. So that again goes through a lot of doctors, scientists who will go through these data and find out whether it's working or not. But none of these data really came out. And with the COVID, there is one more phenomenon, what's called a pre-publication publication. Like instead of giving to a reputed journal, there are these journals which are made for pre-publication. That is, if you have a paper, you just send it to that journal and it will publish it on the internet. So anybody can read it and start following it. But there is no cross-verification, there is no scientific discussion, which basically goes through a real reputed journal paper. So the science is getting diluted now. With so much of information, it's a clutter. Nearly about 10,000 papers come a day. Now, everybody who has some small things, they come up with their own paper. And that's how most of our Ayurvedic and homeopathy papers as immunoboosters came in.
Okay. So you're saying that Ayurvedic and homeopathy medicine is not very effective against COVID-19?
No, nothing is proved.
Okay.
In fact, there is no drug. I'll tell you, simple. There is no drug. Even remdesivir, which everybody claims, and there is a black market going on. There is no drug as far as the virus is concerned. This virus is concerned. No drug which really kills this virus in a way that, if you have a bacterial infection, I can give you antibiotic and I know that it will die. Whereas similar antiviral drug for corona doesn't exist. So all we are doing is juggling around. We started with ivermectin, chloroquine, hydroxychloroquine, and so many other things. Even our ICMR itself prescribed so many test drugs, because at that time we were desperate. We didn't know what was happening. But over 1 year, we know that none of these drugs really work. If somebody has to survive, he will survive because of his body's innate response. Because human body is adapted to fight against viruses very, very effectively. In fact, we get cold quite common. And most of the cold is from the coronavirus. Not this coronavirus, but the different coronavirus. So our body already knows how to fight against coronavirus. But few people who have these metabolic diseases, because this virus basically comes into the body through ACE receptors. So those ACE receptors are the ones which most of our hypertensive drugs, diabetic drugs, all are really targeted at. So those who have metabolic diseases, metabolic diseases in the sense, some of the heart diseases, not all, diabetes in fact, and obesity, weight, uh, lack of exercise. These are the ones which predispose them for these cases. So if somebody is active, somebody is fit, a younger, anybody less than 45, don't need a vaccine now. What he needs to get is go and get a virus. Go and get an infection. So all our lockdown and all our the ways of preventing it really reducing the chance of getting a herd immunity.
Okay, so you think herd immunity is the ultimate solution for this?
For viral infection, that's how it is. Okay. For example, I'll give you a simple example. In America, every year there is a flu epidemic, not pandemic, the epidemic. So every year a new flu comes in, and there is a vaccine for that particular flu, which is common, and everybody takes it. And it's a huge business. In India, we do have flu, the same flu. Again, changes by changes. Nobody gets vaccine because we are used to that. All what happens is you have cold, cough, and then you survive. But there, they go into extreme cases, they die. The reason is they don't have immunity. We have immunity.
And we have immunity because we have lower standards of cleanliness.
Cleanliness, yeah. So maintain that lower standards. And I mean, don't be, like for example, bottled water. It's a newer phenomenon which came in. Both environmentally bad, as well as, you are losing the nutrients which are there in the normal water. Plus these bacteria or viruses, luckily there are these pani puri wallas who really give immunity to rest of the world because you can't have a sterile bottled pani puri. But then that's how we Indians are.
So the disease acts as a natural vaccine, you're saying? Okay.
Against its own strength.
And the best medicine you would say is diet and exercise.
Yes.
Okay. And do you think these people who are desperately in need of, oxygen ventilators, what do you think their chances of survival are on that machine?
Okay, not bad as such. See, even there's about one out of 5 really go into the ICU. And remember, this corona, the initial stages of symptoms are fever and all those. But after that, what happens is, it's about 6th or 7th day, they start getting breathless. At that particular time, they are perfectly fine. They don't have fever, they don't have a headache, they are active. Little bit of body pain will be there. Some people will have a diarrhea. But other than that, breathless. So this breathless is because the body is reacting to the virus and it's fighting the virus in the lungs. There is a damage to the lungs also at that particular point. And they suddenly become breathless. But before that, you can detect it. So my advice is go for a pulse oximeter. Buy a simple pulse oximeter, 1,500 rupees, you should be able to get. So if you have any of the symptoms which you think of, sit at home, put this pulse oximeter and look at the oxygen level. Before they become breathless, the oxygen level starts dropping. So that is when you have to ask the doctor. Get his opinion, see what it is. Consult your doctor. No need to rush to a hospital. Because one thing is, let's say that you are not infected. You just had a cold and you assume that you are having a corona. And you rush to a hospital and get a consultation. There are 10 other patients who are really corona. So you are going there to get this infection. So that's the risk we have, which you have to.
That doesn't solve the problem, it
creates a problem. So even though you didn't have a corona before that, after going and coming back, you had. The same thing happens now in the vaccine, this thing also. Because there will be people rushing to these centers to get vaccinated. So that's again another area where there is a lot of congestion. I saw above 60, in most of the vaccine centers, it's packed.
Okay. What kind of relationship do you think people should have with masks then?
At home, when you're alone or when you're with the family, no need to wear masks. But if you think you are infected, if you have any symptoms or any cough, wear masks. Or if you're afraid, then wear masks. The masks are not really going to prevent you getting the infection from others. But if you're infected, it will stop you infecting others. So there are a lot of asymptomatic people who might be transmitting. That's a whole question mark which the masks are made compulsory. So in a group, best is to keep a distance rather than wearing a mask, and don't wear a mask for a very long time. It's very suffocating. And it itself will affect you. Mentally it will affect you, that you are sort of, not free to express yourself. There's so many other reasons why masks are not recommended when you are not in a crowd.
Okay.
If you're alone, if you're going alone, no need to wear masks. That's not going to really this thing, because it's not going to live around in the open environment. It's only a direct droplet control.
Okay. Now we are going through a second wave. Do you think there will be a third wave
Yes,
and
there'll
fourth
be a third wave, yes.
And do you think COVID will be here even after 100 years from now?
Yeah, if you see all other viral infections, they have remained. For example, the Spanish flu I mentioned, they have remained with us. But we developed herd immunity. See, I'll give you a simple example what herd immunity is. If there are 8 people involved who are already infected, and there are other 2 who are not infected, these infected people cannot really transmit in a large group. So let's assume that whole population has about 80% people who are already infected. So that means there is 1 in 4 chance of that getting spread. So the herd immunity is get almost most of the people infected, because the people who are infected are not going to get infected again. So 80% of the population is once infected, they are already immunized. Take a vaccine, for example. It will take a very long time as well as a lot of burden on the financial this thing to get 130 crore people vaccinated. So these lockdowns are basically prolonging this
herd immunity. But if too many people get COVID-19 at the same time, don't you think that will be a burden on the hospital infrastructure?
Exactly. I was waiting for this question. Okay. This was the concern at the very beginning of 2020, when March, April. The lockdown was justified at that time because our medical infrastructure was not enough. What rest of the countries did, especially European countries, is that they ramped up the whole medical infrastructure in such a way that when the second wave came, they didn't become desperate like us. What India did was we kept quiet. We just kept quiet on the whole medical infrastructure development. We spend minuscule amount on health. Even now, for example, 2020-21, we were the largest exporters of oxygen to other countries. Bangladesh, we sent quite a lot of oxygen. And now, today, we are importing oxygen because we don't have enough oxygen. We could have just increased our own plants and anticipated this. Everybody knew that second wave is going to come. But we thought that we conquered it. That's a false perception in somewhere in November, December we had. That's why all this problem. And even when the very early stages of the spike raising up, we should have woken up again. No, we didn't.
Have you woken up yet?
No, I don't think the government has really woken up. The statements with so many other ministers and other things, it looks as though they're just thinking that somebody will save it.
What kind of reaction would you want the government to give at this moment?
Seeing the government behaving this way, I don't expect anything positive from them. The reason is there is nobody who is taking initiative. Everybody is expecting somebody else to do the initiative and take it. So if somebody takes the initiative, in fact, I had a lot of hopes when Prime Minister was about to address on the 8:45, but nothing came out. Nothing positive, nothing nothing to inspire that there's going to be any hope.
And there was no practical solution.
No, there is no practical solution. Now they are just passing the buck to the states. So the center is passing the buck to the states, and states already are burdened with so many other things. Especially the finances are very bad. The local tax collection has gone down drastically. So without that, they don't have funds. And without funds, now, for example, vaccine has to be paid by either the person who is supposed to take it or by the state governments. We have universal vaccination program, which is supposed to give, the government is supposed to give vaccine free. Not just this one, all vaccines. But then this breaks the whole this thing. Now, even the vaccine level, we did very bad strategy as such. Both these vaccine companies, they asked for about 200 rupees per vaccine from the government, which is just bare enough. I mean, I don't think it's a profit. It's just a bare minimum cost for per vaccine. Government said 150. So they couldn't ramp up the production of these vaccines so that we have a lot of vaccines. Now, since people are paying for it, say 400 to 600 rupees, now probably these vaccine companies might have some capital to ramp up the production, but that takes about 2 to 3 months. It's not, you can't overnight switch on the whole plant and then get vaccine production high.
So how long do you think it will take for the status of COVID-19 to change from pandemic to an endemic?
If herd immunity, if the second wave, we are expecting somewhere to infect about 50 to 60 to 70% of people, then probably in the third wave, we might say that, it's no more a pandemic, it's endemic.
Okay. And a lot of people around me and otherwise also get their information on COVID-19 through WhatsApp groups. Do you think there's an absence of rational thinking and scientific temper among the common people?
Not really. I don't think it's common people. It's those people who are supposed to give information, they are lacking it. Anytime you want to have information, you expect a medical person or a scientist or epidemiologist or somebody who's in that field to give the information. But the information what we are getting now is from bureaucrats, is from politicians who have not studied any of this, who don't know anything about it. They are even advised by those people who are not studied these things. And the fields which are totally different. For example, in medical system, what has happened is it's a specialized system. So a surgeon will not know what physician does, what physician does not know. It's all over specialization. There's a joke, there's a right nostril ENT specialist and a left nostril ENT specialist. If you go for the other one, then he won't know, that sort of joke. So it's all specialized, over specialized. So there are no generalists. So that's why there is nobody who is really advising them correctly. They should have taken advice of those people who are eminent epidemiologists who knew how these things really work out over the time. We have so many examples of how these sort of diseases. This is not the first disease ever to affect humankind. We had a study of flu, which is very well documented, plague, which is very well documented. And we all know how these diseases come, how they spread, how they are going to come again, how we are supposed to get immunity. But when you did the first lockdown, they didn't even create a committee to advise Prime Minister. So somebody's advice, he just did a lockdown.
Okay, I think that's enough about COVID-19. Okay, because apart from being a doctor, you're also interested in trekking and mountaineering. How did that interest begin?
Okay, I was studying in KMC Mangalore. So there was a book center, Atri Book Center. So I had gone to this book center and he has a group called Arona, Mountaineers and Adventurers. So whenever he does a trip, on his table, he used to put a map of the places where he went and the photographs and other things. At that time, I was just a first year MBBS student. I was more interested in learning English. I came from Kannada medium. So I wanted to learn English so that I can speak fluently in English with all others. So my concentration was only to learn English. But then I also saw this photographs. I got interested. I said I will come. And then we started going for various trekkings. So usually on Sundays, early morning we start about 6 o'clock, come back at about 11, exploring most of the Western Ghat areas. So at that time, I learned trekking, mountaineering to these Western Ghat peaks. Did a little bit of rock climbing and all those things. Then end of MBBS, when I was doing my internship, a group from Bangalore wanted to have a camp doctor for a Himalayan expedition. So I fitted both being a doctor as well as with the mountaineering experience. So I said I'll join. Only thing is I don't know how to do ice climb. So we had this group which went to Brahma 1. It's a 21,050 feet mountain, and not climbed by any Indians so far. Even our team couldn't really reach the summit. We had to call back about 600 feet below the summit. It's 4 from Bangalore and 4 from Mumbai, and 1 from Mangalore. So that's the team.
How was your experience in this expedition?
It was thrilling. I mean, in fact, we had that was just when the insurgency in Kashmir was just getting started.
This was in the year 1990, right?
1989.
Okay.
89. Doda, which is now, which was one of the epicenters of most of the Kashmir insurgency, was our last bus point.
Okay.
From there, it's 25 kilometers of trek to the base camp. So it was fantastic. I mean, in the sense, for me, ice climbing was new. I hadn't done it, but they were all there. They taught me how to do it. With the experience, it was fine. So we created a base camp. It was totally 45 days. That is from Bangalore to Bangalore. It was 45 days.
Okay.
So we first went by train to Jammu Tawi, and from Jammu Tawi, it's a bus journey to Doda, and there we hired mules because all the camping gears, food, everything, 11 big army sacks of. A lot of army sacks. So 11 mules were there. So mules carried the weight, and we were trekking. And then we started climbing. We were able to achieve the first, second camp on top of the. It's a ridge, basically a ridge. It is conquered by one New Zealander as well as one British team. No Indians have climbed till now. The foolish thing what we did at that time was not taking Sherpas.
Not taking?
Sherpas.
Okay.
Because Sherpas will carry most of the weights and other things. And they have a technical knowledge exactly which part to traverse, and all those advantages are there. And they are from there. And especially from a coastal region, you have a problem with the altitude. So that was one of my main worry. Being a doctor, I was looking for altitude sickness. So slow climb. In fact, one of the person had altitude problem because he came down from UK and immediately started climbing right from Bombay. He came directly. So acclimatization was not really up to the mark. But then he survived and started climbing afterwards. So there was no issues.
Then how do you physically prepare yourself for something like that?
Physically, like I had to really mentally chalk down, what all can happen. Because once you go there, for example, I'll give you my situation. I was mainly stationed in the base camp. I went to the other side, crossed the moraine. Moraines are what are called, those are glaciers are there. On the glaciers, there'll be a rock which are fallen. So below that, you have ice, water flowing, and it's a sort of a semi-melted ice. On top of that, the stones are there. So you have to cross over to go from one end to the other end. So this is about 9 kilometers stretch. So to cross it and go alone, it's not possible, because every step you keep, you don't know whether it's going to sink down into ice, you're going to fall on the ice or not. So what we do is we rope in 3 people. So at any given time, only one person moves. The other 2 will be standing. So we relay the whole thing, and then that's how we move. So in case somebody sinks, the rope is there, so we'll pull it off. So every step you keep for 9 kilometers is going to be like that. And it's a jagged, very sharp edge rocks. 2 pairs of shoes I took. At that time, it's North Star sports shoes. So it was on tatters by the time we came back. Like all chipped out and other things. So,
You couldn't use it again?
No. I gave it to somebody there. Let him have it.
So you're from the coastal area, and this expedition Brahma is one of the coldest places
Yes.
in the planet.
No, sort of. Okay, it's not coldest,
Okay,
but it's quite cold.
It's quite cold. Okay, then how do you manage your oxygen level, or how do you get how do you survive in that climate?
Yeah. In fact, we were so stupid. 21,050 is the limit of climbing without oxygen. It's supposed to be 20,000, 19,000 to 20,000. Beyond that, the oxygen is so rarefied that you just can't really go. But we didn't take any oxygen cylinders because it was too heavy and other things. So we took a lot of, Maggie, and K.C. Das had given rasagullas, and Camco had given biscuits, but no oxygen.
Only non-essential items.
Yeah, non-essential. On the hindsight, it looks totally stupid, because they were organizing. I was going only as a doctor, and I had no other say on the organizational part.
Did you think of doing some kind of breathing exercise? Because there is this man, called Wim Hof. Have you heard of him? He does that Wim Hof breathing exercise. He submerges himself in ice for multiple hours, and he has the Guinness World Record for that. Do you think something like Wim Hof breathing can enhance our breathing level?
No, these exercises do enhance. Only thing what they do is, allow you to hold your breath in rarefied places for a long time. But they are not going to be like sort of a panacea for where there is no air. I had enough baths in those cold glaciers. 7 days I was in the base camp, so I had nothing else to do other than just roam around, look for some Himalayan bears there far off on the meadows. The nearest human habitation was 1 day walk.
Okay.
So if these guys who went up, they didn't come back, my job was to go back to the nearest village, get few people, and start searching for them. There was no other way. We didn't have any wireless equipment at that time. There was no way of communicating with them. So 7 days of total solitude.
Do you still do some kind of trekking?
I do.
Okay.
I do in Western Ghats most of the time. So usually Sundays, if I get time, just go early morning, go climb somewhere.
In parallel with the trekking, you're also a wildlife conservationist, right? And you also work with the wildlife conservation groups. How has your work been in that field?
Okay, this happened in MBBS days. I was interested in wildlife just as observation. Like the trekking started first, then I started observing as I was going. And then we had a group of medical students and friends who were interested in wildlife. So we contacted WWF, not the fighting group,
the
Worldwide Fund for Nature.
Okay.
So they said they are interested in having a Mangalore branch. At that time, WWF was very popular nature conservation group, unlike now. Now it's sort of subdued. They used to have a lot of nature clubs. Every school used to have small clubs where they discuss about nature, how to conserve and all those things. So they said, you also start doing in South Canara these nature clubs. So Arunachalam Kumar, who was one of the person who made this snake park, which now shifted to Pelikula. The earliest snake park used to be in the Kadri Park.
Okay.
So he and Sunny Tarapan from Aloysius at that time, they were interested in wildlife and snake conservation. There were two other friends of theirs, Sharat. So these were all part of that whole group which basically made the snake park. So along with that, I also got interested into wildlife. Mainly snakes, turtles. I did some study on turtles at that time with my friend Sharat, who finally did a PhD on that particular this thing. He's now in US. So on the wildlife front, I used to have a lot of these small interests. Then I started teaching in nature clubs, where I used to go and give talks on wildlife, on how to identify mammals, how to identify birds, neighborhood birds, like your own backyard, how you can really conserve it. So it was small goals we were planning of. And we, in fact, wanted one branch of WWF in Mangalore. Somehow it didn't work out, so we just abandoned that.
Okay.
But then I started getting more interested into research. So Dr. Ullas Kanant, who was a very prominent tiger researcher, so he called us once to Nagarhole. So we went to Nagarhole. We did some of he was doing at that time prey predator research. So basically, it's like instead of counting tigers, which is the method which a lot of people follow, which is not reliable, his idea was, instead of counting exact numbers, we'll count the prey population, like how many animals which are supposed to be the food of the tiger exist in that particular forest. If there is food, the tiger will flourish. If there is lack of food, see cheetahs, samba deers and elephants, and all these are all the food of tiger. So if there is a lack of those animals, then there will be a lack of tigers. So that was the logic, prey-predator relationship. So he was trying to do this work for nearly about 10 years. Over a year, every few months, I'll do a transact analysis, go in a path and observe how many these animals are there, count them. Statistically extrapolate to the whole forest. So I went there, did one of the survey, then got interested. But at that time also, there was a tiger crisis going on in India. So tiger was almost going to get extinct. So we wanted to have a sort of people involvement. So we took a BBC documentary, which was, and translated into Kannada. The audio part translated, like we didn't have equipment at that time. So we had a VCR, which basically was connected to the TV to play, put it in mute. And then we had a tape recorder, which had the Kannada translation, which was running. So students could really understand what was going on.
Okay.
So what we did was, all around the national park, we identified each of the schools and went there and did this. So we covered nearly about 200 schools in and around the forest. And why we have to save tigers, basically to save the forest. Because there was a lot of enmity against tiger coming and killing the cows and
Yeah. Do you think it's because of development?
it's sort of, we are encroaching their land, and then we are complaining that they are doing something. So there are a lot of encroachments in and around national parks and sanctuaries and reserve forest. People don't think that they have encroached. They think that the animals have encroached their property. So that was the thing. So sort of trying to make them understand. And it was, instead of telling adults, we were targeting the students, their sons and daughters, so that it reaches them. Because if we go directly tell adults, there is a resistance. Through their kins, they will be able to understand. So that was the idea. And that really worked out. Quite a lot of response came during that period. And later I joined post-graduation. Then little bit, strained as far as all these extracurricular activities. So once I passed out and then became my own this thing, I started my own clinic in Moodabidri. Then I had a freedom to do what I wanted. I was not sort of.
Okay. Speaking of freedom, you started your clinic first in Moodabidri, and
Yes.
now you have your own hospital, Prabhu Hospital.
Yes.
How has your journey been running your own hospital?
Okay. That hospital was my uncle's hospital. In fact, my uncle was a surgeon. He died in 88. After that hospital building was closed. So my whole idea of starting a clinic was initially to start a clinic and then see, whether it's worth starting a hospital. Then I realized starting a hospital will be fruitful. Opened that hospital, me and my wife both were managing it. It's a small setup, 10 bedded. So, because we wanted to give personal care. So there are no extra duty doctors, no other doctors. I mean, the freelance doctors come, but other than that, there are no duty doctors. So when patients come, they'll be directly meeting us. There is no somebody else in between me and the patient.
So, is there an appointment process?
No appointment.
Nothing.
You just can come walk in anytime.
So, if I walk into your hospital, will there be a doctor who can cater to my issue?
That I'll decide, because it's a small place.
Okay.
I don't do a single type of practice. For example, being a surgeon, a lot of surgeons only do surgery. So I do surgeries. I also do medical cases. I also look at the cases. So we are trained really to do everything. But unfortunately, what we do is, being a specialist, we compartmentalize ourselves to one specialist. So once I started this, I became a journalist. So I was able to see everything and manage everything.
Do you think over specialization in medical field is a little dangerous, because then doctors will only be concentrating in that area and they may confine themselves from learning about some other area?
It's partly true, not always. In some cases, you need specialization. For example, brain surgeries, heart surgeries. You can't expect the same guy to manage everything else. But they should not forget the basic part. Whereas in a place like Moodabidri, where there's only 3 surgeons now, as of now, the whole of Moodabidri, and we cater for about 2.5 lakh population. There is only 2 physicians.
That's a crisis.
Yeah, it's a crisis, but people don't want to come to a village level and treat. They will stay here in Mangalore and treat patients.
Okay. Let's go back to your extracurricular activities once again, okay? Because you are into mountaineering, trekking, and also wildlife conservation. But again, there's one more thing that connects to all of this, and that's you're a nature photographer as well. And I've seen the photos in your website, drkrishi.com. They're brilliant. Okay, how did this happen, and where did you learn such brilliant photography?
Okay, when I was studying in KMC, there is in our college there was a photography club. Usual rule is, anybody who comes to the second year will get a chance to hold some post in the photography club and manage it, and the seniors will pass it on to the juniors. So when I finished my first year and joined the second year, somebody asked me, "Do you want to try photography club management?" At that time, I used to have Kodak small film camera. I used to shoot just general this thing. So I thought I'll try my hand. So I started taking photographs. Cameras were there, the darkroom was there, and we were able to develop films. At the same time, in St. Aloysius College, there was a workshop conducted by 2 people. One was Yajna. He was a very prominent photographer associated with Udayvani earlier. He was, and Ishwaraya, he was a editor in Udayvani. Both of them did a workshop on photography and photography appreciation in St. Aloysius College. So I attended that, and I was really impressed that I have to be something like that. So soon after that, the next week itself, Ishwaraya was in Manipal, so I couldn't contact him much. But Yajna was very close. He was very close to the KMC college itself. That's where his office was. So evening I used to go and meet him and learn from him. Then I slowly started, teaching others how to do photography, how to this thing. And so that gave me incentive to learn more about it. So then I tried various techniques. I was initially a portrait photographer, then slowly entered into the nature photography part. Then during trekkings and all, I used to carry cameras and then become wildlife photographer. Then went into bird photography. So it kept on, shifting. So now my main specialization is in macro photography, insects, close-ups.
Okay.
So also travel is there. It's a mixed this thing. I'm not really. Again, I'm a generalist as far as the photography is concerned, not specializing in one field.
A man of many talents.
You can call it. And that also gave me another aspect, that I started finding insects which were not identified, not known, spiders which are unknown to India. Then I started publishing. So I started writing scientific papers. So we published around 7 papers on spiders, on various type of spiders. One of the most famous was Harry Potter spider. If you have seen the Harry Potter movie or this thing, there is a sorting hat. When Harry Potter goes into the college, so they put a hat on the person, and then he'll be taken to either
Gryffindor and
yes. So we named this spider because its back was exactly like a Harry Potter's, that sorting hat.
Okay.
So we called it Aerovixia gryffindori. That was the scientific name. So that made us very famous. This is in 2016. So we published. Our basic idea of naming it was bringing children back to science, because now they are so out of this, biology and insects and all those fields, and there's no incentive at all. And if you ask them wildlife, the only thing they know is tigers, or they can talk about lions and zebras and hippopotamus from other countries, but they don't know what Indian wildlife is. So then we treated it referring to J.K. Rowling. So J.K. Rowling saw the tweet, and the tweet went viral. So within a week, we were crossing about 3.5 lakh retweets of that particular news. So then in I don't remember the name of the America, there's one institution which basically awards new inventions in a year. It can be new species invention and that sort of thing. So in 2016, they listed about 10 species, 10 discoveries, which are basically very prominent as far as the science is concerned. And we were number one because of that particular
Okay, that's very
spider.
nice.
So we after the words, we have done quite a lot of work on spiders. Now we're also doing some work on snails. There's a work going on moths. So it's a group work. So I usually I'm one of the cogwheels of the whole system.
Whose idea was it to name it after Harry Potter scene?
No, it looked like that.
Okay.
So my friend Javed, he's one of the spider guys in Mumbai. So he did this. Thing. He named it.
Okay, fine. So. And you're also the current secretary of CyberForum.
Yes.
Okay, what exactly is the work of CyberForum?
Okay, CyberForum was really created to get internet to Mangalore. So in 1995, when India got internet, at that time there was a Videsh Sanchar Nigam Limited, and there was also DOT, Department of Telecom. These two were the two parts to get internet. So Bangalore got internet very early. So August 15th, 1995, Bangalore got internet. But Mangalore didn't get internet at all. So right up to 98, it couldn't get internet. And we were desperately trying because I was on internet and media right from 10 years before India got internet. So,
How is that?
uh, okay, there. This was in summer in 84, 85 again. When I joined MBBS, I thought of buying a computer at that time. More of a fancy gadget than anything else. So I went around, saw there was one computer called ZX Spectrum. This thing is, it had no monitor. So you had to use a TV to see no hard disk, the present day, tape recorder. The cassette used to contain the whole operating system. So you've seen the tape recorders, right? Those
Yes,
cassettes.
okay.
Yeah. Now you hold the play and the fast forward button, and then everything gets loaded into the computer. Then you play around with that. You can do some small coding and some small gaming. So that used to be the computer. Then it was not interesting at all, that whole thing. So then we thought of connecting to internet, because at that time DARPANET was there, the precursor of the present day internet. But India, nobody knew exactly how to do it. So then I contacted few of my friends in Massachusetts Institute of Technology, MIT. They said, you can do an international call and then connect it, and then we can do a discussion. So there used to be like bulletin boards discussion. After that, there was one bulletin board started in Bangalore called CIX. So this bulletin board gave us, way of discussing like how we do in WhatsApp, the present day WhatsApp or IRC chats. So that sort of chat we were able to do. So till 1995, India was still hesitant to get internet. So there were a lot of pressure groups which were built basically to bring internet to India. So, but in Mangalore, there was a problem between the Department of Telecom and Videsh Sanchar Nigam Limited. Because the last mile was basically by the Department of Telecom. The Videsh Sanchar Nigam was up to Pandeshwar, their main head office, they were about to give. But these DOT didn't want to give to the rest of Mangalore. So it's a departmental fight between the governments. So we wanted to solve it. So we created this group where we were discussing about various operating systems. At that time, Windows 95 was just coming in at that time. But ours was more on Linux systems. So we were asking, a lot of enthusiasts to basically adapt to Linux, open source, and that sort of thing. So, but then without internet, it was pretty difficult. Like I used to connect after 11 o'clock, it used to be 1/4 rate to Bangalore. It was a call. So you make a call and then connect to internet and then browse something. And then, so it was possible. And then Airtel came, first mobile system. And they used to have this 1 rupee connection to outgoing calls. So incoming and outgoing was different. So incoming was different. Outgoing calls also you had to pay.
Okay.
Sorry, incoming calls also you had to pay.
Okay.
So it was 1 rupee per minute. But it was cheaper than the STD, where I was paying 16 rupees for the STD charges. That is at 1/4 rate. So I connected using that, and I used to browse through Bangalore. But it was cumbersome, and Bangalore needed internet. So we created this group and called Telecom Minister, BSNL Chief, as well as DOT Chief in the same stage, and asked them to promise, within 2 months we'll get internet. Nothing happened. Then luckily there was one very enterprising Department of Telecom manager came, and Rama. So he was very enterprising. So he made sure that it came, and then we got internet connection. After that, there was a flood of internet connections.
Yeah.
So I was a secretary, and since once the internet came, they didn't have any other function, because our whole motive of CyberForum was basically to get internet to Mangalore. So after 98, it's just running around, but there's no other activity going on, because everybody has internet, everybody's happy. So fine.
Seriously, I mean, everything that we're doing right now is possible because of you and your group. So we are very grateful for bringing
No,
internet to man.
much more than me, Dr. Govindraj. He's an eye specialist here in Mangalore. He's the one who's also, he was a president, I was a secretary. So
Okay.
two of us did that job.
Okay. You spoke about Linux and free software and open source software. How is it any different from what we are using right now?
Okay, right now everything is closed source. For example, whether you are using a Mac or a Windows, it's a closed source. You don't know the source code of that particular thing, what you're doing. The Linux is based on a system that everything is open source. So whatever you are trying to use, and if you think that it's malicious, it's got something sending it to some other way, you can go through the code. If you are knowledgeable enough, you can find out, okay, this is the part where they are really trying to subvert, and you can edit it. The open source, the whole idea is anybody can be a developer. So if you know how to add few parts, you can add it. For example, one of your modem is not working, but your friend has an idea how to make it work. So write a code and then add it, then spread it to all the other peoples in whole of the world, and they also get benefited when they buy that modem. So that way, it's more of sharing your work as well as getting other people's work. But everything is transparent. Whereas these proprietary codes, for example, Windows, you don't know how much of permission. I mean, you give permission to whenever you install Windows, you don't know what information is being taken out, how they are going to monetize it. What all the social media are basically doing is that only they are monetizing. So you browse something on Google, this thing. Next time you go to Facebook, you'll get the same advertisements. So because they are all interlinked.
So do you think internet privacy has become an issue now because we don't
Definitely.
use free software? We use, we don't use open source. We use closed source.
Yes, partly is true. But even in open source, if you are using the media,
Social media.
then again you are getting slowly watched by those people. There are a lot of browsers which are open source. For example, Firefox is open source.
Okay.
Even though it's Windows, it's open source. So you can go through the code and you can find out exactly. So instead of using Chrome, which is a closed source, there is a open source of Chrome called Chromium.
Okay.
In fact, Google basically takes the Chromium and then makes it into Chrome, which is its own. So it takes the open source and then creates it. Most of the softwares what Google uses on the back end is open source. They take a benefit of the open source, but they are not transparent to you.
Okay. They're selling closed source.
Yes, they're selling code. Let's talk about Firefox.
Okay.
Firefox is a sort of a free software which is available in all the platforms. So that is very very good example of using a software which is open source. So now, if you are using Chrome or Edge, Internet Explorer now become a Microsoft Edge. Both of them are sort of a closed source. So that's why you can really use one of these free softwares, and they're free. You're not being charged. Now the problem what happens is whenever somebody says free, like for example Facebook says it's free, it's not really free. You are the commodity there. They are selling you. So even though they say free, they are not really giving you that freedom of not capturing your data. The same thing is happening with WhatsApp. Now the newer rules which are supposed to be now implemented to May 14th basically says that they can't sell your data. So till now you had that privacy, but you are getting that for free. And now these companies, especially owned by, there are only three now, the major players. There's Google, there's Microsoft, and there's Facebook. So these three people are basically, trying to exploit as much as possible from your interaction.
So you think that kind of monopoly is once
bad.
again dangerous?
It's
okay. Let's conclude with one last topic, and that's your interest in bleeding edge technology. What exactly is bleeding edge technology?
Okay, bleeding edge technology in the sense, we always say that cutting edge technology. So it's when you cut something, there has to be a bleed. So the bleeding edge technology is basically beyond the cutting edge. The cutting edge is probably what we are seeing it now. I'm planning to sort of look for something which can become the next generation of cutting edge. So that is the bleeding edge. Now, this I have really lost interest in the last 2 years because I got inundated with too much of research on various things. Initially, I used to be a lot of tech savvy, and I used to do a lot of research on technical part. Now I slowly withdrawing on that because I don't find it as interesting as the rest of the hobbies what I have.
Okay.
So bleeding edge technology is something which can come tomorrow or next year. So that is more of a prediction than actually what's happening.
Like AI taking.
How AI is going to take over. So that sort of thing. Or is AI going to do everything what they promise? So go through that and learn more on that extreme edge of something which is yet to be implemented. I did that more for my environmental side of this thing because the technology at the end of the day basically affects environment in one way or the other, whether it's positive or negative. So I wanted to know, if somebody is coming with some proposal, okay, they're going to come up with few ideas, whether it's going to really hurt the environment or benefit the environment. We all think that most of these technology really benefit the environment, but it's the other way around. Even take an example with the so-called very environmental friendly electric cars. We all think that the electric cars are basically going to solve all this carbon problem, fuel issues. But no, because at the end of the day, you need electricity, and that electricity has to come from somewhere. And there are enough people who are coal mafias who basically wants these electric plants to be run through coal.
What if we shift from coal to solar? Yes.
But solar, again, the problem is the solar energy is useful if you try to use it immediately. But if you try to store solar energy, then it's going to be again environmentally harmful because it again takes the lithium and other minerals from the earth. So it's going to be bad. So immediate use, yes. Suppose you have a solar panel on your house and you are using it directly, fantastic. But whole city, there is going to be huge solar panels and they are going to run the city. They may be almost equally bad as far as these coal and other things.
This is something very unheard of
because we don't see the bad effects of solar. The panel basically made up of silicon. So that requires a lot of mining of sand to basically create that silicon this thing. And the life of those panels are not indefinite. They die within about, say, 5 to 6 years. So you have to replenish them.
So do you think solar is a better alternative to petrol and diesel, or do you think it doesn't make any difference?
No, it doesn't make any difference. It's just shifting. You are shifting the goalposts.
Wow.
Shifting the goalpost from one to the other. What we basically require is the carbon dioxide we are producing because of burning of fossil fuels. We need a way to bring it back and replenish the earth again. So if we have a method of capturing all those carbon dioxide and bring it back, probably that's a better method, still with the existing fuel sources. But unfortunately, there is a lot of money involved in each one of these technologies, and that's pushing it to the next level. And nobody is talking about the bad effects of it until they suffer.
Then do you think nuclear is a better option then? Because
to a certain extent, yes. To a certain extent, nuclear is a better option because if you see nature, the sun is basically a nuclear energy, which is giving out. So naturally, it's there. But how we manage it is the problem. We badly manage most of the nuclear plants because the plants are not constructed in a way that they should be. If we have a way of using nuclear energy in a much better, much safer way, probably that's a better option.
Because we are still paranoid from Chernobyl and
Yes,
Fukushima.
yes.
Do you think there is scope for more research and development in
Definitely, there is
Okay.
a scope. I'm open to this thing. I'm not like environmentalist who says, okay, this particular thing is bad, so we have to this thing. I want to know why it's bad. Is there any better alternative?
Because environmentalists keep saying solar, 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 but now I'm getting to know, okay, there's another side to it as
Yes.
well.
No, those are all lobbies.
Okay.
In fact, in environmentalists, there is more lobby than anywhere else because they are the influencers. You look at them exactly like one of those YouTubers or Instagrammers, influencers who are basically influencing the people's mind. So you have to think from that particular aspect. Then you realize, okay, what Buddha said. Don't believe just because it's been written. Don't believe because it's in the books. Don't believe because it's been taught by teachers. Try to find whether it's really helpful to whole of the nation. And if you really find that it is helpful, then believe in it and then follow it. So
Brilliant. And on that brilliant note, we will have to conclude this podcast. Thank you so much for spending your time with us.
thank you. It's my pleasure.